Scarborough is a community of communities, diverse, inclusive, and proud. If you want to see the best of Canada, the future of Canada, it's right here. If you want to see the future of healthcare, it's at Scarborough Health Network. I'm Michelle James. I'm the Vice President of People and Transformation. Our hospital has been on quite a unique journey since our sites came together in 2016. A journey to create our first strategic plan, find our new identity, and plan for our facilities of the future. Today, I'm sitting down with our CEO, Liz Buller, and our Chief of Staff, Dr. Dick Zoutman, to talk about our bold new strategic plan. We'll be taking a closer look at how our inspirational new mission, vision, and values and 4 strategic directions will help us to shape the future of care in Scarborough and beyond. But first, we're going to need some coffee. Despite all of this time I've spent working in healthcare, I am still so excited about this strategic plan. It's the first time I've had an opportunity to be involved with a strategic plan for a brand new organization.
Yeah.
You know, in a community that so needs this transformation that we're planning. And I'm just like, are you guys feeling the same kind of excitement about it?
It's very exciting to be able to focus on Scarborough at large and look at what do they need for the future, our community that we serve. So.
Yeah, I really love that vision that we've landed on. Like, you know, don't you feel that the promise and the potential in that, Canada's leading community teaching health network?
Oh,
Yeah.
I'm really excited about it. I think we, again, have a very unique opportunity to be absolutely achievable, Canada's leading community teaching health network.
I do get asked sometimes, though, what's the difference between the mission and the vision? Have you had that come up?
Yeah. People ask what's the difference, but I think the vision is where we see ourselves in 10 years. To me, the mission is why we come here every day. You know, improving lives through exceptional care. That reminds us why we're here today. That we're here to give the best care possible for everybody in Scarborough and in our network. And that's the difference to me, anyway.
Yeah.
And if we're living that mission every day, that helps us move towards that vision. And what I love about both the vision and the mission and our whole plan was it came from the people.
Yeah.
It came from the voices of our staff, our physicians, our volunteer. It came from the voices of our community. It came from the voices of our community agency partners. It's a very inclusive, comprehensive vision and mission, which really makes it even more exciting.
And you use the word inclusive, which is one of the values as well. And I find that folks are really latching on to those 4 values. And it took us a long time to kind of figure out which 4. We got a lot of feedback from the community about, you know, which words we should include. But people are giving us that strong endorsement.
Yeah, for me, I love them all.
Yeah.
And I really see values as the entire basket. And I get that, you know, some rise up, you know, more often than others, or some days more than others as we're looking at things. But a wise former leader taught me years ago that really our values aren't something that we can pick off the shelf the day we want them, but really trying to seeing how they go together, all of our values. And that's what I love about our 4. And they came from the people. They really are so complementary together.
Yeah, they work well together.
One of them is building a culture that empowers and inspires people. And that is key to us being successful with all the other 3.
Yeah.
Right? And that really is our opportunity to emphasize that people are our greatest asset, and we really want to harness the creativity and the energy and the knowledge of our staff.
Yeah, well, being able to transform the patient experience through innovation, education, and research, I think really helps tie it all together for everybody, because we're going to include people in that. They're going to be able to try out new practices, and what the depth and the quality of service that we provide here is so good, but we need to do even more in terms of documenting that, so that the world sees what we're doing.
Well, exactly, and the quality is what we're here for, to provide the highest quality and safest care to our patients and families when they come through the door, and also the highest quality and safest environment for our staff and physicians and people to work in. And so that is also what I love about our strategic direction. Even the population health and health equity, focusing on population health and health equity, it's really both internally and externally for our community. So to your point, the population health, the health equity, the innovation pieces, it takes us right back to the vision. That is what's going to make us Canada's leading community health network, of reinventing the role of the hospital today. And that completely aligns, I believe, with where our provincial mandate is going, and looking at what is the role of the hospital today and redefining that. And our directions will take us there, again, to where people will be coming and looking at a new way of how we deliver services for our community. We want to be more than just the catcher's mitt of what comes through our door and treating. We want to be understanding what's coming through our door and how do we improve the health and wellness of our community through learning what is coming through our doors, and then reaching out and partnering with many agencies, whether it's our school boards, our homeless shelters, our churches and synagogues and temples. Really looking at a different way of how we connect with our communities will set us apart.